All right, get cozy, everyone, because we are diving deep into the sometimes frustrating, often exhausting world of insomnia. Sound familiar to anyone?
I think it's safe to say most people have had at least a brush with insomnia at some point in their lives.
Definitely. And you've given us a ton on this topic to unpack, so let's not waste any time. We all know those nights, right? Tossing and turning, wishing sleep would just not happen. But when does plain old sleeplessness actually become insomnia?
Ah, that's the million-dollar question, isn't it? We've all had those nights where stress or maybe a little too much coffee keeps us up. But it's when those sleepless nights turn into weeks or even months that we're crossing over into insomnia territory. That's the chronic insomnia we're talking about today.
It's way more common than you might think. Did you know that about 20% of adults experience insomnia at some point? And for women, it's even more prevalent.
It's true. The stats are pretty surprising. It seems like women are definitely more susceptible to insomnia than men. There are some theories floating around about why. Could be hormonal fluctuations, could be the added pressures and responsibilities that often fall on women's shoulders. More research is definitely needed.
That's really interesting to think about, and it highlights just how complex this issue really is. Okay, so we have this surprisingly common sleep disruptor affecting a big chunk of the population, especially women. But before we get into the how and why of it all, let's talk about what actually causes this sleep thief to rear its head. What are some of the things that contribute to those sleepless nights?
Well, it's rarely just one thing, right? It's usually a whole bunch of factors, kind of like a perfect storm that leads to insomnia.
A perfect storm of sleeplessness. Okay, so where do we even begin to untangle all of this?
I think a good place to start is with the things we can usually do something about, our everyday habits and our environment.
Makes sense. What kind of things are we talking about here?
Well, think about shift work for a second. If you're constantly changing up when you sleep, your body is never going to get into a good rhythm, is it?
Talk about throwing your body clock for a loop.
And then there's the obvious but easy to forget stuff. That phone in your hand, the laptop you're probably watching this on, all that blue light messes with your sleep big time.
Yeah, I'm definitely guilty of scrolling a little too close to bedtime.
And we can't forget those things we think help us unwind but actually sabotage our sleep. Alcohol, caffeine, they might seem relaxing in the moment, but they can really mess with your sleep cycle.
I guess that late night coffee isn't always the best idea. But it's not always about our habits, is it? Sometimes there's an underlying medical reason why sleep is so elusive.
You're right. Certain conditions, like hyperthyroidism or heart failure, can definitely disrupt sleep. Even chronic pain, restless leg syndrome, sleep apnea, those can all lead to those sleepless nights.
So many possibilities. It seems like almost anything can impact our sleep, from the choices we make to the things we're dealing with physically. Anything else we should add to the mix?
Oh, absolutely. And this is where it gets really interesting because our mental health plays a huge role in all of this.
You mean stress, anxiety, that kind of thing?
Exactly. When we're stressed or anxious, our minds tend to race, making it almost impossible to shut off and drift off. And on the flip side, when you're not sleeping well, those mental health challenges can become even worse. It's a vicious cycle.
So insomnia can be both a symptom and a cause of those mental health struggles.
Exactly. And that's why getting help from a professional is so important because even some medications used to treat mental health conditions, like certain antidepressants, can actually worsen insomnia as a side effect.
It's like you're caught between a rock and a hard place. You're trying to address one problem, but it might be making the other one worse.
Mm-mm.
Okay, so we've talked about what can cause insomnia, but how do you know if what you're experiencing is actually insomnia? What are some of those telltale signs beyond just, I can't sleep? It seems like everyone's always saying, ugh, I have insomnia after just one bad night. So how do you know if it's the real deal, not just a one-off thing?
Yeah, it's definitely more than just a night or two of tossing and turning. With insomnia, those sleep troubles, they really stick around.
Okay, so how long are we talking about? When should you start thinking, okay, this might be insomnia?
Well, a good rule of thumb is if you're struggling to fall asleep, stay asleep, or both, at least 3 nights a week, and it's been going on for 3 months or longer, that's when it's time to really take notice.
3 months. That's a long time to be dealing with poor sleep.
It is. And it's not even just about how much sleep you're getting. People with insomnia, they often wake up feeling totally exhausted. Even if they technically got a decent number of hours, it's like their sleep isn't actually refreshing their bodies and minds.
I can see how that would start to impact other areas of your life.
Oh, absolutely. And that's actually another big sign of insomnia. How it spills over into your daytime, it messes with your focus. So concentrating at work or school becomes a real challenge. Your mood takes a nosedive, you're irritable, on edge, maybe even more likely to snap at people.
It's like insomnia hijacks your whole system. Your mind, your mood, even your ability to make good decisions, it's all affected.
Exactly. And here's a curveball. Sometimes people don't even realize they have insomnia. There's this thing called sleep state misperception, where someone consistently underestimates how much sleep they're actually getting. They might be clocking in 7, 8 hours, but they wake up feeling like they barely slept a wink.
That must be so frustrating. Your body's getting the sleep, but your mind's not getting the memo.
It can be. And it often leads to a lot of unnecessary worry and stress about sleep, which just makes things worse. That's why it's so important to talk to a sleep specialist. They can help figure out if it's truly insomnia or maybe something else entirely and point you in the right direction for treatment.
So let's say someone's listening to this and thinking, yep, that's me. I need to talk to someone. What's that process like? Are we talking about those sleep studies, where you're hooked up to a million wires?
That's a common fear, but it's not always that intimidating. The first step is usually just having a good chat with a sleep specialist. They'll ask about your sleep history, your patterns, any problems you're having, how long it's been going on. They'll also want to know about any medical conditions, medications you're on, even your lifestyle.
So it's like piecing together the puzzle of your sleep, figuring out all the different things that might be contributing to the problem.
Exactly. And honestly, in a lot of cases, that detailed conversation, along with maybe keeping a sleep diary for a couple of weeks, that's enough to get a
With
diagnosis.
no scary sleep lab right off the bat.
Well, they might suggest a polysomnography, that's the official term for a sleep study, if they think another sleep disorder might be at play, like sleep apnea, for example. The sleep study helps them rule out those other possibilities.
Makes sense. So you've gone through the assessment, maybe had a sleep study, and you have a diagnosis. What happens next? What can you actually do to get better sleep?
That's the million-dollar question, right? And the good news is there are a lot of different ways to manage insomnia. It's not one size fits all. But one of the most important, and this might surprise you, is actually pretty simple: sleep hygiene.
Sleep hygiene. I feel like I've heard that term thrown around a lot, but what does it actually mean in practice?
It's basically just about setting yourself up for sleep success, creating an environment and a routine that tell your body, okay, time to wind down.
So like a pre-sleep ritual.
Exactly. A warm bath, reading a book, maybe some calming music. And being consistent is key. Try to go to bed and wake up around the same time every day, even on weekends, to keep your body's natural clock in check.
Consistency is key. I hear that a lot. What about things to avoid before bed?
Oh, absolutely. Those blue light devices we talked about earlier, yeah, those are public enemy number one in the hour or two before bed. That blue light actually suppresses melatonin, the hormone that helps regulate your sleep-wake cycle. And as tempting as that nightcap might be, alcohol and caffeine are best avoided close to bedtime. They can really mess with your sleep later in the night.
So it's about making choices that support your sleep, not sabotage it.
Exactly. And then there are the environmental things. Make sure your bedroom is cool, dark, and quiet. Invest in some blackout curtains if you need to, and earplugs can be a lifesaver. And of course, a comfy, supportive bed is a must.
It's about creating a sleep sanctuary, a place where you can truly relax and unwind.
Exactly. But while good sleep hygiene is the foundation, sometimes you need more. And that's where other therapies like CBTI or cognitive behavioral therapy for insomnia come in.
I've heard a lot about CBTI. Can you break it down for us?
Absolutely. CBTI is all about identifying and changing those negative thoughts and behaviors that are feeding your insomnia.
So not just creating a relaxing bedtime routine, but actually tackling those mental and emotional roadblocks that are keeping you up at night.
Exactly. For example, a lot of people with insomnia get anxious about bedtime. They lie down and their minds start racing, worrying about whether they'll fall asleep or not. CBTI gives you tools to challenge those thoughts and replace them with more balanced ones.
So instead of what if I can't sleep, it's more like I'm creating the best possible conditions for sleep to happen.
Exactly. CBTI also looks at those behaviors that might be perpetuating the insomnia. So things like stimulus control therapy, which helps you associate your bed with sleep, not with being awake. Like if you're lying there for 20 minutes and sleep's not happening, you get up and do something relaxing until you feel drowsy again.
So you're retraining your brain to see your bed as a cue for sleep, not for watching TV or scrolling on your phone.
Precisely. And then there's sleep restriction therapy, which sounds a little counterintuitive, but it can be really effective. It involves limiting the amount of time you spend in bed to improve your sleep efficiency. So if you're only sleeping 5 hours a night, you might restrict yourself to 5 hours in bed initially, slowly increasing it as your sleep improves.
Like you're compressing the sleep to make it more restorative and then gradually expanding that sleep window as your body adjusts.
Exactly. Now, beyond CBTI, other approaches can be helpful too, depending on your needs. There's acceptance and commitment therapy, or ACT, which focuses on accepting those difficult thoughts and feelings around sleep without letting them control you.
So instead of fighting those racing thoughts, you learn to acknowledge them and let them pass without judgment.
Exactly. And then there's mindfulness, which is all about paying attention to the present moment without judgment. Mindfulness-based therapies can be really helpful for managing stress and anxiety, which we know play a role in insomnia.
It's about calming the mental chatter and just being present in the moment.
Exactly. And of course, there are those alternative approaches like paradoxical intention. That's where you try to stay awake, kind of like tricking your brain by taking the pressure off.
Fascinating. Now, we can't talk about insomnia without mentioning medication. What's the role of medication in treating insomnia?
Yeah, it's an important topic. And like with any medication, it's about finding the right balance. Medications like benzodiazepines or the newer Z drugs, they can be helpful in the short term for promoting sleep. But it's really important to be aware of the potential for dependence and tolerance, especially with long-term use.
So medication can be a useful tool, but it's not a magic solution. And it's crucial to use it under the guidance of a healthcare professional.
Absolutely. And ideally, medication should be part of a broader approach that includes lifestyle changes and those behavioral therapies we've been discussing.
It's about finding that personalized puzzle solution for better sleep. Well, that was quite the deep dive into the world of insomnia. We covered everything from those sneaky causes and symptoms to the latest and greatest in management techniques. As you've heard today, there is hope. Better sleep is out there. It might take a little trial and error to find what works best for you, but don't underestimate the power of making your sleep a priority. Until next time, sweet dreams.